First, we will discuss the community development social work. What is community development social work? Community development is a process where community members are supported by agencies to identify and take collective action on issues which are important to them. Community development is a process of social action in which the people of a community organize themselves for planning and action, define their common and individual needs, and solve further problems. What is social work in community? Social workers in community development can be found in many areas of practice and various settings. Community practice can involve community economic development, such as improving local economies in rural areas experiencing outmigration. It can include working with citizens, groups, and organizations to interface with large systems, institutions, and political processes. The identity of a community varies widely and changes depending on the context of the specific issue or social problem.
Social services and social work have important role in helping the people to improve the quality of life by creating awareness and sustain the community by creating employment opportunities on their own effort.
As well as social work, community development is an organized professional to extend the helping hands to an individual, group, and community for their betterment and sustain them to help themselves. A social worker is a profession who works people heritage to help them manage their daily life with respect and dignity.
What is the role of social work in community development? Community development is the core component of social work. Every individual and society aspire to live a healthy, tolerant, safe, inclusive, and fair life. Social work services that have essential contribute to achieve the goal. Social work with the knowledge of literature and practice can immensely contribute to community development. Social work as a profession and community development. Social work profession is a broader than mass discipline, concern the range and type of problem addressed with setting in which the work takes place, the level of practice, interventions, use, and population survey. The main task of professional social work can include a variety of services, such as case management, counseling, human service management, social welfare, policy analysis, policy and practice development, community organizing, international, social and community development, advocacy, teaching, and social research.
What is the role of social worker in community development? First, the case worker, group worker, community organizer, need analysis, project manager, facilitator, middle manager, counselor, research, and role in Grama Sabha. The community development aim. The aim of the community development approach is to give power to people and communities affected by the issue under discussion. And community development also aim to encourage sharing and to create structures which give genuine participation and involvement of public in development activities.
Community social workers help communities function. Some work directly with individuals, conducting needs assessment and making referrals to resources in the community. Others assess needs on a larger scale. Social workers may be community builders or community.
And now, we will proceed to aging gerontology's social work. What is gerontology aging social work? Gerontology aging social work focus on elderly population to holistically address their changing physical and mental needs. The experiences with grandparents and elderly people in the community tends to emphasize the physical aspect of aging. The elderly faces a complex array of psychological, social, emotional, and financial challenges as well.
Aging comes with many challenges. The loss of independence is one potential part of the process, as are diminished physical ability and age discrimination. The term senescence refers to the aging process, including biological, emotional, intellectual, social, and spiritual changes. This section discusses some of the challenges we encounter during their process. Aging and gerontological social workers work with elderly populations to holistically address their changing needs. Aging populations demonstrate greater incidence of depression, social isolation, dementia, and also financial issues. What is aging gerontological social work services? Home-based social services. Gerontological social workers often help clients returning from hospital stays to set up home health care social services. The level of care provided is dependent on the client's functional level, family support, and access to other healthcare services. Community social services. Gerontological social workers have access to a range of powerful tools that social workers can use to meet their clients' needs. This means that the medical social workers can coordinate with doctors, occupational and physical therapists, nurses, and so forth when helping their clients. Specifically, social workers who work in these environments may assist patients with submitting medical documentation, retrieving records, organizing information, counseling, coordinating family and social visits, and much more.